I flew from Washington, D.C. to California, where Professor Mazet runs the One Health Institute at the University of California Davis School of Veterinary Medicine. What came out about Ebola, with Guinea and its spread, there'd be funerals, people would lay on the bodies, you know all of this sort of thing. But I was reading some of the articles about some of your work, and one of the things that I found interesting was in Bangladesh, these date harvesters.
Right.
And it's an incredible story, and it's a small fix, but it made a huge difference. Tell that story.
Yeah, and I want to say this is actually some of that work, the really good stuff came even before the PREDICT project from other researchers. But I do agree with you that it's a fabulous story in that it was a fix that was easy to motivate. So as you started to tell us, but there's a virus, Nipah virus, a very dangerous virus, and it happens to be very transmissible from bats into animals like pigs and to us. And bats like a lot of the same things, just like the sea otters like the sushi, bats like sweet date palm sap. And the sap is harvested for juice for people to drink. And when it's harvested, you basically, just like a maple syrup spike in a bucket kind of piece, you spike the tree and it drains into a bucket. Well, the bats would come at night, and there are camera traps that we can see what the bats do, and they come at night and they drink and they urinate and defecate into those buckets while they're drinking. And so somewhat to protect for disease, but even more to protect from yuck. Some of the harvesters of that sap started to put a bamboo kind of guard, a skirt, we call it, a bamboo skirt around those buckets. And the studies that are super exciting that were done after, part of our team, is looking at the harvesters that use the buckets versus the harvesters that don't, and testing their sap, and the sap is clean for Nipah virus from the bamboo. So it's a bit motivated by disease, but that's a little harder. As you know, it's hard to say, don't hug your kid who has influenza because you're going to get influenza. It's a little bit easier to say, you don't want to drink that yucky bat poop, do you? Right? So disgust is a great motivator. And so we have to learn all of these skills, and that's why it's important to bring in all the colleagues from different disciplines, the cultural anthropologists and the social scientists that know what is motivating and what isn't, and work with the communities, because even those experts get it wrong. The communities really tell us.
And it's so interesting because I guess one wouldn't suspect that that's going on until you do this sort of research, and then you can really kind of nip it in the bud, right?
Yeah, you can. And it's wonderful when you have those sort of quick fixes. Not all of these things are going to be quick fixes. As you mentioned in Ebola, hundreds to thousands of years of burial practices, cultural practices of sending loved ones off after death is a much harder fix to change that practice. So why not get even further upstream and keep them from getting it in the first place? And that's what we're trying to do. It's much easier to get a mom to get their kids not to play with a dead bat because it's disgusting. And that's where their kids are going to get exposed to Ebola.
Jonna Mazet earned her PhD in epidemiology from the University of California, Davis.
So these are reruns of what you thought were positives.
She believes by studying animals, diseases can be prevented and controlled before they become full-blown pandemics.
Yes, in a different room with a different computer.
One of the quotes in this article that talked about the episode in Bangladesh said that the Holy Grail in pandemic prevention is to understand where this next virus is coming. You must be a proponent of that. How difficult is it to convince people of that?
I think it's not difficult to convince people that that's important. I think where we get into trouble, or we get the naysayers, if you will, are people try to equate and say, you're going to take resources away from doing surveillance in clinics on sick people to spend it instead looking in the forest or wherever you crazy people are going to find the viruses. And we're not saying that. We do not advocate for any change except for improvement, but any reduction in actual surveillance of humans for disease. That would be crazy. That needs to happen. It needs to be improved. What we're saying is we can put better tools into the hands of those clinicians to do that better if we gather all of this data and really make a difference on the front end. We can, at the same time, improve the laboratories to be able to do the diagnostic tests and help the communities understand their risk factors. So it's really a multi-pronged approach to get to the same place, but no one's saying stop doing the good human surveillance. In fact, in the PREDICT project, in the second 5 years period, we added human surveillance, and we're looking for the sharing of viruses between those animals in the communities and the people from the communities that had fevers of unknown origins and went to the clinics to try and get a handle on what people are getting sick from in those communities.
The PREDICT project was a global effort to hunt for animal viruses before they became pandemics. The program had its skeptics. Now, after 10 years, it's been shut down because of a lack of funding. Knowledge is power. I mean, this is vital stuff. You mentioned naysayers, and I found a quote from one of them.
Sure.
You had to expect
You
this.
wouldn't be a responsible
exactly.
journalist if you did.
So I'll read it to you because I
Okay.
want to give you a chance to respond.
Okay.
A lot of this stuff they produce is hype, referring to PREDICT's work.
Okay.
It's more PR than science. And then it goes on to say that viruses mutate quickly. No amount of discovery can prepare for that. Some die out. They don't go anywhere.
Sure.
Others adapt to new hosts and go on.
Sure.
I imagine when you start work like this and you throw yourself into it,
Yeah.
and you see all the people working for free, you've mentioned it more than once, and you see this commitment and this passion, were you surprised at the naysayers, and how do you respond to these comments?
Oh, I'm never surprised. And I'm a scientist. I have 2 doctoral degrees, and that's a lot of my family especially thinks that's crazy, overeducated. But I live in this community, and the reason science is great is because we keep each other in check, and we have to be critical of each other so we stay true to doing the right thing. So I don't even mind it. I think it's good. I think it's healthy. This particular criticism, there's some pieces in there that are useful. There's others like, just throwing out hype and things like that. I think we get that criticism because I do things like this. I talk to you because you ask, the people are interested, and I do think it's critical that scientists do a better job communicating. I'm not great at it, but I at least try. I throw myself out there and let people criticize me because I think the communities here, the communities in China, the communities where we're working all need the information, and they need it in a form that's accessible. If I just write my scientific papers, and we have almost, I think maybe even over 200 peer-reviewed publications that have come out of the PREDICT project, that's not hype. That's not PR. But we also try to get the information into the public's hands, and I think that's important. Other scientists might not think that's important. We can disagree, and that's okay. Now, as far as the scientific side of that criticism and that viruses are going to mutate and there will be new viruses, that is true. They don't, surprisingly, mutate. Many of the viral families that we're looking at that cause human disease don't mutate that much. And if we don't do this work, we won't ever know what's true and what's not true because we just wait for the one virus that we study because it made someone sick. Some of those mutate quickly, but some of the others that we found, some are actually very homogeneous. They haven't changed very much at all and have probably been around for the millennia. So again, this data helps us understand that and say where to put the resources. If there's a viral family that's mutating really quickly, maybe we need a baseline, and then we need to put the resources in being able to pick it up when it's new. But if there are ones that are really bad actors and they aren't changing a lot, let's think about next-gen countermeasures. Can we make a new vaccine that can protect for the whole viral family instead of just the one virus we're making the vaccine to now? That would be a better target than the one that's mutating so quickly, because this one, we can actually make a difference. That's what the data allows us to do. If we don't ever start, we'll never get there.
The other part of that is, okay, we can keep doing what we've been doing for forever. People are dying. I mean,
Right.
Wouldn't that be your?
That is my reaction to the overall criticism. Is I don't want to live in a world where we have the technology to make a difference and to be able to get in front of these problems and be ready for them and not use it and just sit and wait for the next one to come get my family. I'm not doing that. So criticize all you want, and maybe science will get even better and we can do it a different way. Maybe our way isn't the best way, but it's the way we can do now. And there are a lot of us that are willing to put our time and energy when we don't have to. We can go into our labs and sit quietly. We don't need to be killing ourselves traveling all over the world to make these collaborations happen. We're doing it because we believe in it.
As has been the case in Wuhan, China, reacting to a virus comes at a price, both to the economy and to society. But Jonna believes that cost can be eliminated by identifying and understanding a virus before it jumps from animals to humans. Jonna and her team still work closely with colleagues around the globe, including China. Talk to me about your work in China.
Yeah, we're really excited and proud of the work that we're doing with China. The Wuhan Institute for Virology and also the health sciences at Wuhan has been an amazing partner. We've also worked with the CDC, the Centers for Disease Control, and some of the provincial CDCs. And we work now primarily in southern China, Yunnan and other areas where there are these really important interfaces. I mentioned it's the wildlife diversity where we're going to find the most viruses, and then where those people are living in intimate contact using the wildlife, if you will, for food or other things, where there's higher risk of transmission. So we're getting a handle on those risks, and we're seeing outcomes. The project as a whole has discovered over 100 new coronaviruses. Of course, you know the SARS coronavirus was devastating to China, economically as well as in deaths. Maybe even some, if they're being really objective, it's hard to be objective when you're talking about deaths. Some would say the economic side was outweighed the severity of the number of people that died and spread to this continent all over. So we've done work to follow up on that, which is exciting as well. We found for the first time serologic evidence of exposure to SARS. We've been able to actually find risk factors in people who report having undiagnosed fevers that are very much related to animal handling, butchering, hunting. So we're able to help people understand their risk factors. So, and then we're even able to find certain species of hosts, like the horseshoe bat, that uses and has viruses that use the same receptors that can get right into human cells. So, so we're starting to identify those issues together with our Chinese colleagues and really follow up on something we know was important, SARS, but find new viruses where we didn't know they existed that are very similar in the same viral family and other viral families. So it's been exciting. I think in China, we're way over 60 novel viruses discovered.
Wow, wow. Let me just talk like a regular guy.
Okay.
Bats are bad news, aren't they?
No, bats are amazing.
But they are bad news. I mean, reading this, I was like, wow.
Okay, let me start with, we focus on those species that the literature, the scientific literature, helps us identify as being high risk. And a couple of things make species high risk. Their ability to sort of adapt to human populations is one of them. So bats and rodents, and even in some countries, especially in Asia, monkeys or non-human primates, tend to be able to live urbanly and connect urban and wild areas, especially the flying ones like birds and bats. So birds and bats, because they fly over long distances and sample from great regions, tend to also be the things that we worry about for bringing us things from those regions. So, so bats do tend to have a lot of viruses. They have a lot of viruses in the viral families that have made people sick in the past. So we do worry about them. Rodents, if you look at history, plagues and everything else, rodents are really heavily involved with that. So that's important too. Influenza, one of our biggest human health problems of our time, birds are the big player there. So we really do focus on those species that share space and time and pathogens with us. Bats also, as they're covering those long distances, they're connecting landscapes and pollinating. Some of our most endangered plants that we need for food and for good habitats and aesthetics living on a beautiful planet are pollinated or seed dispersed by bats. We need them. They also, some of the species are insectivorous. They keep the pest populations down that also carry other viruses that make us sick. So we need to figure out how to live safely with bats. And that's something else I'm super proud of. We have put together a sort of community engagement tool, a book, a picture book about living safely with bats. And we work with communities to deliver that material. And we do it in actually hundreds of languages by having folks. The text is in English, but they are live translating it and delivering it to communities in very specific local languages. But we've also translated it into about 12 languages, and folks that are not on the PREDICT project are using that Living Safely with Bat books. And there's an African version and an Asian version.
So that educational piece, long term, the results will speak for themselves, right?
Absolutely. And I think another great example in China that you see, and it's not just PREDICT, it's the post-SARS era, but we've worked really hard with markets and communities to explain risks from bushmeat and especially bats. And our evidence is showing that there is much less bushmeat in those live markets than there was pre-SARS. And even between SARS and when we started the PREDICT project, we're seeing that there's far less wild meat, far less bats in the market. So people are getting the message, the market, the request for that bushmeat is going down. And so we're seeing less people put at risk on the hunting end of it, as well as in the markets and the consumer end of it.
Because of the coronavirus, China has now banned the trade and consumption of wild animals. Wild birds, just like people, also get the flu. And while it's rare for people to get infected, it can happen. So it's interesting, we were talking about bats, but birds also can travel great distances.
Sure.
And I think you were saying this one's a perfect illustration. So what are we looking at?
So Julia has this beautiful dark morph Swainson hawk, and Swainson hawks are amazing creatures, and they can migrate and do migrate all the way from South America. So we think about California being kind of protected in suburbia here, but we are connected to the whole world. Even if you don't travel, the animals around you are traveling, and they come with their pathogens, and we need to be careful of those, and we also don't want to hurt them and give them our pathogens.
As Jonna and her research team develop a genetic and ecological database, she believes it's wiser to prevent outbreaks rather than fighting them after they start.
So we have the controls.
But her primary mission is to detect viruses before they blow up into epidemics. And that means studying across species. It's a unique approach, one not always fully supported. What does the world look like as we move forward? I mean, how do you want to see it look as a result of the work that you are so passionate about?
I mean, I would like to have a healthier planet. I don't advocate for eradicating these viruses because I think they play a role as well. And when we try to eradicate, we're generally pretty unsuccessful, and we possibly could create a hole for the evolution of something worse. So I think, like we need to learn to live safely with bats, we can learn to live safely with viruses because they're part of our ecosystem, our biosphere. But I think we can understand our risk and protect ourselves, and we can have health systems that are more forward-thinking and able to respond so that we don't have epidemics and pandemics. That's really, I'd like to see the end of the pandemic era. I really would.
So let me finish by asking you, as you've gone along this process, I imagine that detecting that first virus is a heady experience, but as you look through this whole history, what's made you smile, and what makes you optimistic as you look towards the future?
Oh, that's a super easy one. I mentioned the hundreds of people that have worked on this project. Very, very many of them were quite junior in their careers, and they are now senior, and there's an amplification effect. They are training people to be respectful of each other across scientific and policy and health disciplines, but also to be citizens of the world and understand that if we work together, we can actually make such a bigger difference than if we go and do our own small little tiny piece in the laboratory. So we have a whole world of new kind of scientists and health policy professionals, and I think those people are going to save the world. And so if I could be a little bit proud, but mostly just happy, it's that those people exist and they're working on this, and they're going to do more and better than we could have ever imagined.
Kind of a virus of your own making that's spreading around the world, right?
I mean, I didn't want to say it because people tease me, but I like to infect the world with the One Health approach.
And we'll leave it there. Thanks so much, Jonna.
Thank you.
Delight.